personal dentist, and I am grateful for his services. I have learned so much from him. Dr. Gonzales is board certified in sleep dentistry from Tufts University in Boston. How many have heard of Tufts University? Yeah, it's a pretty famous university, pretty good name, pretty good school, pretty rigorous program. And Dr. Gonzales has been through that program. That's in addition to his Doctor of Dental Surgery that he has. And he doesn't just do sleep dentistry, but he does general dentistry also. He's located in Round Rock. I know there's a lot of the vegan community that are up in north, and so thank you for coming south for this potluck. But he's up in Round Rock, and the practice is called Paloma, Vista Dental. And I was wondering, Dr. Gonzales, did you bring some business cards with you?
I did, yes.
Oh, okay, got some business cards. Can we put them out on the table where the name tags are? Can we,
yes,
if people would like to take your business card? Okay, we'll do that. And there are many other wonderful things that I could say, but you just got to hear what he has to say because it's fascinating. So thank you, Dr. Gonzales, and the time is yours.
Thank you.
Thank you, Dr. Carney, for the opportunity to come and speak something that's passionate to my heart. Of course, as a dentist, people think, well, the title of this talk, what I'd like to do, the objective of today is to show you how the impact of breathing, inappropriate breathing, obstructions of breathing can cause issues with our sleep, which can cause a lot of inflammation and therefore a cascade of health problems. And unfortunately, as great as the medical community is, Dr. Carney alluded a little bit to that where, is that better? Yeah, okay. She alluded a little bit to that, how family practice, internal medicine, they're on a crunch to see patients quicker, faster, more, right? And unfortunately, when you delve into airway issues, and I'll tell you in a minute why that we use that term a lot in dentistry as opposed to in medicine, is because the dentist is in a unique position to identify breathing disruptions that can occur in your sleep, as well as things that can affect you 24/7. And so with that, I'll start the talk. And so again, my name is Dr. Gonzales. I'm in Round Rock, and I got two logos there because part of my practice is general dentistry, but the other part is dental sleep medicine. And that basically is helping patients with sleep disorders where PAP therapy or positive airway pressure therapy is not working, or sometimes it has to be done in combination with that, and I'll explain that in a minute. So I'm located, I guess you can't really see it, right there in that corner. And the name of the practice I got from the neighborhoods basically that are by me, right? So I had to come up with a name. So that's where it came up from. And so, anyways, those are the logos. And Dr. Carney talked about my background. I went to dental school in Houston, then a resident in San Antonio. And I had an opportunity to train at Tufts University Dental School, where they have a program in dental sleep medicine that helps you identify and work with patients who are having issues breathing and bad sleep at night. The other opportunity I had was in Louisiana in their oral facial pain program, and what that means, anything that hurts in your head and neck besides your teeth, your jaw, your ears, nerve problems, and those problems exist, and it's a gray zone, unfortunately, that a lot of times physicians can't address, nor dentists for that matter, so there is special training for that, and I'm sure everybody here has heard what TMJ is or has some idea. That's just one segment of it, and I'll show you why that's linked to breathing and sleep in a minute. And of course, I did some implant training in Dallas, and here at UT, some how to run your business, right, as a dentist. So I am a member of these professional organizations that continue to help me train and keep on to the latest current stuff. So let's get into the talk. I called it, how has dentistry impacted our lives, right? What is the role of dentistry? And I'm just going to go down the list here for the sake of time with some of the things that you see here that have impacted the profession. And so as the profession's evolved with dental radiology, that's 3D and digital. And of course, the oral systemic connection is huge because in the mouth, a dentist who's trained well in the connection can identify things like inflammation, diabetes, leukemia, things of that sort that are kind of starting to resurface, right? You can see it. So sleep medicine, a subspecialty of medicine, has created this airway revolution in dentistry. And so what do I mean by that? So a friend of mine in Seattle, he actually put together a proposal with the American Dental Association, and I was fortunate to be part of that last year. I went to Chicago, and I'll show you some pictures later in this talk, where I met some of the leaders in sleep medicine who are supporting a policy that was recently released last year. And it's just a policy, but what they're encouraging is dentists to screen patients for sleep disorders, breathing, snoring, and things such as that. So with that said, I want to show you a quick little video. Some of you maybe have seen this if you saw this National Geographic video, but I want to take that to show you why this is important. See if that'll get going.
It was about 3:30 in the afternoon. I got a call from my friend telling me that there'd been a serious accident. I was about a 5-minute trip from where the accident happened, about where we are now. The driver of the other car veered across all 4 lanes of traffic. And right here on the side of the road, my family died. I lost my wife, my son, and my daughter because someone was behind the wheel who had not had enough sleep. If we truly understood the importance and the need for proper rest, tragedies like mine would never happen.
The sleep of Americans is being decimated.
There are substantial numbers in the American population who sleep 5 hours and less per night.
You don't know how much sleep you've lost until it hits you.
Percentage-wise, adolescents are most prone to sleep deprivation.
I don't have any sleep. I don't know what it is. If it's the pressure, the pressure I put myself under.
We underestimate the power of our need for sleep.
When you get your rank, you're there because the Army wants you to think strategically. If you're getting less than 6 hours of sleep, you're cognitively impaired.
Short sleep is a risk factor for obesity.
And there's evidence that sleep loss may promote disorders such as Alzheimer's disease.
If you don't get the restorative sleep that you need, cancer is going to grow so much faster.
Sleep apnea is really a killer.
Insomnia is associated with increased risk for depression, anxiety disorders, substance use disorders.
The drugs that are commonly available impair every cognitive function, and millions of people take these drugs, and bad things happen in the middle of the night.
When sleep gets shorter than 7 hours a night, you tend to see escalation in obesity, diabetes, cardiovascular disease, and death.
So that is I think you can find this on YouTube or Google it. You'll see the movie is at no charge. You can find it. But that was just a little intro clip to that. That was a couple of years ago. Of course, there's a lot more accidents I could put up there that have recently happened that are linked to sleep deprivation. But what I want to get into it now is why, the question why. Why are people sleepy besides electronics, gadgets, things that stimulate us the way we live, society's light. The invention of the light bulb, I remember when I was in Boston getting trained. As good as electricity is, it also did a bad thing for our sleep, because now we can trick ourselves into thinking I got more time, and our body naturally starts to shut down with the melatonin as darkness sets in to really go to rest, right? So with that said, I was watching the news one day, about 2 years ago this happened, and the Carrie Fisher, the person that played Princess Leia in Star Wars, and that was on the national news that this was potentially linked to her death. She had a heart attack in her flight, and I'll show you why in a minute how that is linked. So again, these are just stats from the American Sleep Association, talking about the numbers of people with these sleep problems, insomnia, and you can see from this, percentages are pretty high, people just snoring, and I'll talk to you about why the dangers of snoring is important to get looked at. So I'm throwing in some slides from a presentation because I also provide a treatment to kids, and I was going to touch on the subject of kids because it's important to catch kids earlier. When I mentioned the ADA policy, American Dental Association policy that was instituted, their premise was the epidemic that's growing amongst our kids, and that's due to jaw development. If you start looking around, even if you look at older movies, people 50, 60 years ago or longer, their jaws were much more developed. And the question is, well, why is that? People from other countries that eat a more hard, nutritious diet, that have to use the muscles to crunch on, there is not a lot of orthodontists in some of the jungles. Of course, there isn't, right? In the jungles of South America and Africa. But these people have amazing jaws, and it's because they eat a more closer diet to nature, right, that was intended. So, what are the signs? And I'm going to go through this, just put the list here so you can see a lot of the things that we see with things we can visually see, and of course symptoms that some of the children display with, like bedwetting, snoring. Well, how's that related to your breathing? Also things as diagnosis, right? You may go to the doctor and they may diagnose your children, your grandchildren with some of these issues. And the interesting thing is there's links, for example, to ADD, ADHD, to sleep deprivation. And when they found and did a study, a largest study by Dr. Karen Bonnick, they found that 50% of these kids who had that diagnosis actually were sleep deprived. They had sleep disordered breathing. And I'll tell you what that is in a minute. And so basically, there was a study done by a doctor in Chicago who invented these products, and they found basically 9 out of 10 kids have one of these signs, symptoms, or a diagnosis of this, right? So it's a real problem and it's growing. And a lot of it has to do with the diet that the kids are eating, more processed foods and stuff in packages, right? Things you don't really have to work on to crunch and chew and get jaw development. So, and you can see that 20 years research has linked to sleep disordered breathing. On the bottom, I call it breathing disorders of sleep, or a bad airway, right? If your airway is not good, you can't get good sleep. In other words, if there's an obstruction, something clogging your nasal cavity, your tongue, that's going to cause you to not get good sleep. So, this is just a little historical timeline, and I'd like to, it's busy, and hopefully I don't confuse you with that, but I just want to kind of show you this because when we talk about sleep medicine and sleep, it doesn't go that far back. It was discovered, you can see here, in 1966. In fact, unfortunately, God bless his heart, Dr. Guilleminault, the gentleman up there in the middle, he just passed away 12 days ago. He was 80, and he's considered the father of pediatric sleep medicine. And he discovered something that we use in medicine called UARS. That stands for Upper Airway Resistance Syndrome. Unfortunately, if you go get a sleep study, as the timeline continues into our current time, there's a lot of ongoing research with this. And what the ongoing research is, there's a term up there, the IFL, inspiratory flow limited breathing. And I'll show you how that can cause a real havoc on our general health and well-being. So, the sleep appliances came out in around about the 1980s. That's Dr. Bergeson who invented these Healthy Start appliances that I use on kids. That's just one way of helping children grow their jaws back and getting their teeth where they should be. But the interesting thing, his story, I got the privilege to meet him in person, and he shared with me that when he was in the 60s looking at why are these kids getting smaller jaws, and so the development of their faces, and so he came up with these devices. As he started to help them, he noticed that the children were beginning to sleep better. Around that same time, medicine in the 60s was discovering sleep apnea, right? And so now you fast forward to our time, and there's a direct correlation to all of this, and this is why dentistry has now become involved with medicine, working with physicians to help children and adults to get better breathing and therefore better sleep. Yes?
What does FSS stand for?
Functional somatic syndromes. Yeah, I'm going to show you a slide of what those are in a minute. Thank you for asking that. So these are just people that I've met. Dr. Rouse, Dr. Carney knows him well. He now teaches at an institution in Arizona, which teaches thousands and thousands of dentists from across the world. And again, dentistry has gotten very involved with this because going back to sleep medicine, there's only 6,000 sleep physicians across the whole US, right? And you got 200,000 dentists across the whole United States. So people just go more to the dentist than they do to their physician, and when we put you back in a laying back position and say, look back there, you can identify these problems very easily. And I'm going to show you pictures here in a minute. Again, there's the ADA policy that came out. That was in, there was a conference that I mentioned that I went to in Chicago. And just this, again, to show you, the American Association of Orthodontics just this year began to look at, oops, let me go back here. Sorry. So the American Association of Orthodontics just had a conference, and that was just back in January, a couple months ago, because again, there's this changing shift in dentistry to identify these things early in children, and not just about moving teeth, right? So again, a definition of a dentist does not include these terms, tooth, teeth, cavities, and gums, even though that's kind of what we look at and fix. But it really talks about how we can identify disorders of the stomatognathing system, which is the head and neck, muscles, jaw, teeth, and now the airway. So again, in 2016, they had a conference, and this is when this movement began and saying, okay, what is the dentist's role in identifying these problems? And so there's the policy, and I'm just going to go through it really quick, but you can see the language in there is talking about these disruptions in normal breathing. And you're like, well, what does that have to do with my sleep? And it has to do everything with the airway collapsing and causing altered respiratory control mechanisms. And of course, we know what snoring is. We joke about it. There's upper airway resistance syndrome, which I'll talk to you a little bit more. And then of course the big one that most people know about is obstructive sleep apnea, which is where you stop breathing at night for a couple of seconds throughout the night within an hour, for 10 seconds or more within an hour. So, and it can lead to health problems. So again, the language of this policy is now out. It was just released last year, and again, our profession is not caught up with it. So again, there's some training and some getting this out to the whole army of dentists that are out there to encourage them to screen patients. And so there you go. There's like 11 items on there, and then number 1 just says dentists are encouraged to screen patients for sleep-related breathing disorders. So I say that so the next time you go to your dentist and they start asking you about your sleep or how you're breathing, if they haven't asked you already, or maybe they're haven't been trained on this yet, don't be surprised, because that's coming, right? And so the thing that I like about this policy, it talks in item 2 about deficient growth and development. This is really related to kids. Dr. Guimeno, who I just mentioned, who unfortunately just passed away 2 weeks ago, what was very dear to his heart was finding these problems early in kids, because he knew, in fact, they were all there at this meeting, that if we can find this early in kids, so that the goal of a dentist now is to develop an optimal physiological airway and breathing pattern. In other words, get these kids breathing better so they may not have all these issues that we see in adults that weren't caught. So again, this just talks about oral appliances, the process of how to work with the physicians on all these issues, and again, more language with that. And I like to show books because if you can go to Amazon, or you probably won't find these in most bookstores, but there's a lot of recent information. Everything I'm sharing with you has been published within less than a year, or even just a couple months ago. So Dr. Wilkerson published this book, and he talks about the Great Awakening in our profession. And again, it's all in reference to these compromised airways, breathing patterns that cause craniofacial growth and development issues, malocclusion, that means crooked teeth that don't fit in the mouth. And Dr. Gelb, who's in New York, wrote a great book called The Airway Health. And this is basically the way that when you're focused on this, you have to see how is somebody breathing. And in dental school, they actually teach you the reverse way. Let's look at the teeth, let's look at how the bite fits together. So now there's been this paradigm shift. How is a person breathing? How are they sleeping? How does it affect everything we do, right? And so here are just some pictures of adult teeth that I can see that are signs of these issues. And when you see anterior wear on the front teeth, bone development on the lower jaw, scalloping of the tongue where the tongue is pushing against the teeth and the teeth are being imprinted, that's a sign of bad breathing and probably having obstruction at night. In fact, the medical literature says that 70% of the time somebody has a scalloped tongue, they probably are very at high risk of having sleep apnea. And then of course the teeth begin to notch from the bruxing, as you can see what's called an abfraction. And then that middle lower picture is just to show you how you can't even see back past the air hole there. The tongue's blocking all that. And then some people, unfortunately, as I mentioned earlier, have very constricted jaws, a lot of crowding, and that becomes a problem with their breathing. Let me go back here. A friend of mine, Dr. Liao in DC, has written some books, but he talks about sleep bruxism and how this kind of really increases the blood pressure because of the stress going on at night. And I like what he asked. There on the bottom it says, can grinding be a form of self-administered CPR for airway obstruction? I would have to agree that that's a true statement. A lot of times people break teeth. They come into the dentist, fix it, you can fix it, but I guarantee you that tooth's probably going to break again if that problem exists. Because the number one desire for the body is to breathe and get fresh oxygen in, and it'll do anything to get that and destroy anything in its way, including the teeth, which is the hardest substance in the human body. So on that statement, if our body is destroying the hardest thing we have, imagine the little vessels and arteries and all that in our bodies under this incredible stress to get more oxygen. So this is the airway that we keep talking about. That's basically showing you a diagram. We were created to breathe through our noses, mouth closed, tongue at the roof of the mouth. But if you got small jaws, crowded teeth, a big tongue, and the tongues can swell too. The diet, inflammatory diet, that can cause your tongue to swell. And then and you can see right in the middle that the biggest obstruction is at the back of the tongue. So that's why this becomes a dental thing. And so, and Dr. Hendon is in New York, and he says that everything that a dentist does in their practice daily influences the physiology of the airway, whether they realize it or not, right? So that's why it's important that every dentist, now that this policy has been proposed, that they educate themselves on this to help their patient. Again, dentists, we see a lot more people more often than the physician because of the cleanings that patients come in for, their hygiene. And I wanted to show you the technology that we use, at least in my office, and this is cone beam CT, and this is becoming more and more of a common thing in dentistry. It is expensive technology, but what it shows you is amazing. Here's a patient who has the red, you can see the red, it's color-coded. The red is where the obstruction, the airway is just smaller than normal. The green is the size it should be, and right about where her tongue is, that gets very, very small. So this patient, this is her TMJ. If you look at this, you can see bone on her jawbone there that's starting to kind of melt away, deteriorate. So this patient, interestingly, I did some dental work for her. She wanted to be sedated, And so I sedated her, and you have to put him on a monitor, right? And so I noticed that she began to obstruct and desaturate. And so I had to do a jaw tilt maneuver to get her breathing. And I encouraged her to go get a sleep study. Unfortunately, she moved to California. And so I'm hoping that she followed up on that. But I really believe that she was destroying her jaw joint due to this incredible desire to breathe. And what I witnessed that morning in my office was undeniable. I even printed the strip from the monitor and said, give this to your physician, and just to show them, you know, when you're asleep, what I saw. So here's another patient who has a big airway, and it's all green. You don't see any red there. But this patient, unfortunately, also, okay, this is a different patient, the one that with a green airway, but her nasal obstruction. So I'm putting this up there for us to show you what we can see that sometimes a physician can't see due to this technology. So this person's not breathing through her nose 100%. There's partial obstructions of her nasal cavity. And then again, unfortunately, in her case, she's destroying her jaw joint and has TMG issues. Again, encouraging her to get a sleep study, right? So, Dr. Simmons, who's now got an office here in Austin, he actually trained under Dr. Christian Guimino, the gentleman who passed away recently. And they use a very unique technology that's maybe only in 3 places in the whole US. They're at Stanford University where it was invented. It's called a PES, esophageal pressure monitoring. And so he's done research, and he's a physician, a sleep doctor, and I like what he says, the TM joint is really the joint of the airway. I had to agree with that based on the evidence that's out there, both in the dental and medical literature. So, I'm going to go back here. So this is somebody who's been diagnosed with sleep apnea, grown male in his 60s, and you can see just the things we see, that little teardrop-shaped things called a concha bullosa, inflammation of the sinus cavity, and yet his airway is not that bad, but he has obstructed breathing. The point I'm trying to make, no matter if your airway is tiny or huge, it's all depending on the desire, or the effort, I should say, to breathe, that creates the negative pressure that will then have that airway collapse. And the analogy I like to use, if you're taking a shower, I'm sure this has happened to everyone, if you turn the shower on and the water pressure increases, if you have a shower curtain that can suck up to you, and that's why they kind of made them bow out, so that avoids that problem. That's something in physics that occurs when you increase turbulence. And so that's exactly what happens with these airways. They're very collapsible, and you can't tell because we can't measure that. So again, you can have a huge airway and a very small airway, but the sleep study is really what determines it. The propensity of a smaller airway is that we know that you have more problems, and that can be traced. And just one last example of this, and I'm going to jump into the kids stuff here in a minute, is this person came to me, and he's been on a CPAP for years, and he can't tolerate it. He's having health issues, and I think you can see the obvious. His nasal cavity is completely blocked on the right side. They kept trying different masks and all that, but this technology in our world really helps us to identify obstructions. So he definitely has to get that corrected for any success. That's it, more zoomed in. And again, this just shows you where can these obstructions occur. The nasal valve, the sinus cavity, behind the upper roof of the mouth, the back of the tongue area. So those are all areas where this can occur. And again, this, I said this a minute ago, the stability of the airway, the size of the airway, and then the urgency, the effort to breathe. So the thing I'm going to jump into before I get into the kids here is the tongue. I talked a lot about nasal breathing, the obstructions in the nasal cavity, how that can cause mouth breathing. And you'll see that very clearly with kids, and how if that is beginning to happen, it can cause a whole cascade of issues with their development. So the tongue is, think of a knob on your stereo that controls the volume. So the tongue's kind of like that. They call it an airway dilator. So that regulates, it controls what they call the airway patency, the amount of air coming through. So the size and shape's affected by the size of the tongue. And a friend of mine, Dr. Lau, I mentioned a minute ago, I like his saying, joking around, he says, the O in OSA is the tongue blocks the airway, and it does. The tongue is really the problem that we see that begins to block. So you can have your sinuses corrected, and that's definitely important. You can have surgery done to correct all that. But at the end of the day, sometimes the tongue ends up being the corporate that blocks the back of that airway. Again, that's where the dentist trained in this can definitely help somebody, adult patients I'm talking about. And now we'll get into some of the kids in a minute. One last thing I wanted to show, since this is a group interested in nutrition, diet, this shows you, this was a study showing, so you can have, for example, somebody who's obese, overweight, and they lose weight. But interestingly, the tongue won't necessarily lose weight. You can still have the fat deposits in your tongue, and that can cause you to have obstructions at night. So that's what that study showed, and of course there's further studies that show how do you get your tongue to lose weight, like get it in shape, right? It is a muscle. And there is something for that. And so the other thing I wanted to show you with the tongue is that it stimulates what we call the sympathetic nervous system, right? That is your fight or flight. You know, I'm sure if you're familiar with that, if you get in an emergency, you want to run or fight. So the tongue blocking our breathing stimulates this to trigger, and that can lead to anxiety and, of course, fragmented sleep. And so myofunctional therapy is an important therapy that is really big in Brazil. The Brazilians are really on this, and they actually, every newborn child, it's a federal law, they check for tongue ties because they realize that this could become a problem. And so they clip them and release the frenums. In the US, we're not there yet. We're not checking for that. But anyways, when myofunctional therapy is used to exercise the tongue, physical therapy for the tongue, to get it at the roof of the mouth, this is what the studies show, that the AHI gets reduced by 50 and 62% in kids. This diagram is to show you how dentistry and medicine are different, how we recognize these things. And here's a better, more detailed slide of that. Go back here. So this slide is showing you if we catch kids early, we can intervene through orthodontic means, dental procedures that can really grow their arches, allow their teeth to erupt in. But we also have to check their breathing, if they're a nose breather, not a mouth breather. And the interesting thing that I see a lot as I got into this working with kids more is I told you I have a background in oral pain. So this term BDS, right? I was like, what is that, right? So this is out of a very new textbook. So BDS is actually body distress syndrome. And that is basically when your doctor's saying, I don't know what's going on here. You have these symptoms and it sounds like this, but everything we've tested for doesn't come back positive, so I don't know, try something different, right? Take a vacation or whatever. So what those are linked to, fibromyalgia, irritable bowel syndrome. Dr. Carney asked the question, what is FSS, functional somatic syndromes? There's the list, the functional somatic syndromes, and you can see that 2 of those cross into our world of dentistry with the TMJ, the migraine headaches, but the most of those are related to sleep issues that can be diagnosed with a sleep study. And of course, if you notice the list, there's a lot of stuff on anxiety disorders, right? So that's kind of the key there. I like showing this because, as I was saying earlier, a lot of times medicine, as busy as they are, as great as they are, they only have so much time. So they're looking for, okay, what can we label this with? What can we diagnose it with? And the obstructing sleep apnea and the snoring is just the tip of the iceberg. Below that, if you remember the Titanic, what sunk the ship was the iceberg, right? If you look at what's below that, I have that FSS again, IFL, inspiratory flow limited breathing, TMD, bruxism, headaches. LPR is laryngeal pharyngeal reflux. You've heard of acid reflux. So this is a very slight misting, a post-nasal drip that's constantly going in the back. You can't clear your throat. Very, very common, undiagnosed, and is an airway-related issue. So, all right. So this is a cool little thing. Dr. Dement, who's the father of sleep medicine, he said you need 3 things to stay healthy. What are they? He said you got to sleep well, you got to eat well, right? We agree with that in this group. And you have to exercise. So those are the 3 things to stay healthy. I would add that you have to breathe well. And it definitely is an airway issue, because if you don't breathe well and you have obstructions, you are definitely not going to sleep well, and you're not going to eat well. And you can see that with kids that can't swallow crunchy, hard stuff because their airways are smaller, so they want something in a liquid or gooey or mushy, right? And that's a bad thing because it doesn't, number one, give them the nutrients they need, and second, they don't grow to develop their full potential and their craniofacial structures. So, this is just a diagram. I threw these terms out, and there's a lot of information here with sleep-related breathing disorders. And I asked the question, does this still hold true in 2019? And I'll tell you why I don't agree that is, and the evidence is clear that how they classify sleep apnea is through a sleep study, whether you take a monitor home or you stay at a lab and get a sleep test done. But caution, not all created equal, because I've seen people misdiagnose or not diagnose. And again, that goes back to the technology that is used. So, with all this means there, if you read there, you can look at that the AHI, just the Greek terms, apnea means closure of the airway, hypopnea is a reduction of the airway, and of course they do this index. So if you stop breathing more than 5 times within an hour, 60 minutes, for 10 seconds or more, you're classified with sleep apnea. The question I ask, if somebody stops breathing for 6 seconds or 8 seconds, I'm pretty sure that fragments your sleep, and that's why, again, dentistry has got into this, because we can see the clenching, the grinding, and the bruxism to protect that airway. What you'll find is the people that have the severe form of this disease don't clench hard as much. It's the people who are more healthy who have the fight in them to really try to breathe better. But what happens with that scenario is they release cortisol. So cortisol is a stress hormone. It can then go to your abdomen, cause weight gain, and then no matter how good you're eating, so if you're having that, those hormones get out of balance, and therefore you have now health issues that can lead to bigger problems. So, I'm not going to show this video for the sake of time. This is ResMed's video. It has a long little demo of what sleep-related breathing disorders are, and all it shows is the obstructions of the tongue. And so that, I believe, you can Google it and find it, and you'll get good information from that. All right, so Dr. Paloma is a Stanford-trained pediatric sleep physician, and he says sleeping should be silent. No such thing as normal snoring. Should not be snoring at all, right? So I would say that mark then gets moved to snoring being a disease. And now there's evidence to support that. This was just this year in a journal. It says, do you snore? There are health reasons to see a doctor about it. And is snoring risk for OSA or other diseases? Question. Again, the diagnosis of snoring, these are classifications, and now they do have something where it's saying snoring is a cardinal symptom of obstructive sleep apnea. So basically what I'm trying to tell you, if you hear somebody snoring or if you snore yourself, definitely get it looked at, because it's a sign of worse things that can come. All right, so here, this is really the Bible of sleep medicine. It's a very thick book like that, and it gets bigger every year, it seems like, when they publish it. But the thing is that simple snoring can cause cognitive impairments, especially in kids. That means kids can be their learning is disrupted in school. You know, if they go to school, they may not have a lot of interest. They're just, maybe they're the kid that tries to get all the attention. So in that sense, kids will manifest sleep deprivation different than you and I as adults. They'll try to keep agitating themselves, running, or doing whatever, right? And hence the term ADD, ADHD kind of sometimes gets slapped on without further evaluation. So if anybody in the room has a child or someone they know has been labeled or diagnosed that, I would encourage, if they haven't looked at their sleep, to look at that as well, because that might be the cause of it. And so, anyway, so this is going on. Dr. Paloma also says, how can kids follow their dreams if they have no dreams, right? So if a kid is not sleeping and they're not learning in school, then what do, right? So this is why this is so important, because, as a country, our kids are the future. And so if they're not getting good sleep, their jaws aren't fully developing, they're not eating right, it's just a cascade that later, somewhere down the line, we'll have to pay the price. And that's going to be with healthcare costs to react rather than to prevent. So that's why the ADA stepped in, American Dental Association. Now, we got to say that dentistry's always been very preventative in its DNA. If you go to the dentist, hey, they say get the sealant, come get your teeth cleaned. And you would think, well, you probably would want somebody to not do that, right? So you can work on their teeth later. But the reality is that we want to prevent things because it does help people live longer, healthier. So this makes sense to us as dentists to find kids before the problem manifests, right? So that's what this whole conference was about and the policy. That's Dr. Guilleminault, who passed away recently, considered the father of pediatric sleep medicine. I had the opportunity to meet him. That's Dr. Gonzales, who's written some of the textbooks and are around the world for pediatric sleep medicine. Dr. Simmons, who I mentioned, who's here, has a satellite office now in Austin and was trained by Dr. Guilleminault. Dr. Sheldon, who runs one of the biggest pediatric sleep centers in Chicago. And that's Dr. Bergeson, who invented the Healthy Start, which I've been showing some of those slides. And basically, I show you that I had the privilege of meeting them, but this is not about me. This is just to show you that I had the privilege of meeting some of the world's experts at this meeting. And none of these guys, except the guy over here is a dentist, those are all physicians. And so they were all there to support this endeavor, to help promote this agenda to make America healthy, right? So, sold out crowd, they had to turn dentists away. They said, we're sold out, sorry, come back next time we have it, right? So, and this is a statement that was made by, I don't know this person, but this was the theme of the event. Many things can wait, children cannot. Today their bones are being formed, their blood is being made, their senses are being developed. To them we cannot say tomorrow, their name is today, right? So we got to do something now because we can't wait. The hourglass is running out on them. I'm going to show you this quick little video here.
That was holding it. He's still holding it. He's trying to take in air. There he goes. Okay, now watch. He's holding it. He's holding it. He's holding it. He's holding it. He's still holding his breath, and that's going to gulp again. There he goes. That was it again.
See, as his face is turning red here from the distress, mouth breathing. This is his mother, by the way, recording him. His name's Eli.
There he goes.
And she's going to intervene here to show you how mouth closing, pulling the jaw forward, nasal breathing helps overcome this.
Of not getting calm breaths in. Now watch what happens when I take his jaw and I just bring it forward. If I can, let's see if I can. And I open his airway.
Notice his face is getting less red. The blood flow there. Now he's sleeping better. Nasal breathing.
Quiet breathing. There we go. Now he's breathing through his nose. And I grab his airway, I'm opening his airway, just pulling his jaw forward ever so slightly. And now he's breathing through his nose quietly. His mouth is a little bit open, but he's breathing through his nose.
So that little video shows you, and these are other books I mentioned that you can get on Amazon, but recent stuff. And what it talks about here is, again, it addresses the importance of sleep, child's airways, the quality of their sleep. It just talks about, 24% of all children and 35% of children under 2 years of age have frequent sleep problems. And one such class of sleep disorders is what I showed you a minute ago, that spectrum, sleep disordered breathing, and it affects their brain, their heart, their blood pressure, their growth, their appetite, their teeth, and jaw development. In other words, crooked teeth in the mouth, we believe now, and it's very controversial, my next statement I'm about to make, but when you have a jaw that's smaller, where the teeth don't fit into it, and the jaw's small and the teeth are crooked and crowded, for years the profession of orthodontics has either extracted teeth, made the teeth straighter, But the question now is, could that be an airway issue? And if it is, how are we going to fix it? And that's the difference between traditional dentistry now and what I call airway-focused dentistry, because now you're focused on the health and well-being of an individual, not just their teeth. And so that's what I'm very passionate about and very excited about still being part of this profession. Again, more books on, this is an ENT doctor, not even a dentist, and he talks about we should be looking at the structures and the development of the jaws of kids. And again, he's not a physician, he's a breathing expert, the Buteco breathing technique, breathing through your nose. And he just talks about how appropriate breathing through the nose and how people can develop if that's not achieved. Again, this is just more data, the support showing from medicine, research from Dr. Guilleminault. And what I wanted to show you with this is on your left, and then on the right, this right here, you see the normal airway and the restricted airway. You can see the black line. This cursor doesn't show up very well, but what I'm trying to show you, you can see how this is much smaller than that one over there, right? So now you can see the face of how one of these childs is pushed back. You see that? More evident, and the jaw should be more squared, pushed out that way. And of course, there's expanders you can use to do that. And here's another study that showed that, in non-obese children, it is a oral-facial growth problem. Again, questions, am I a healthy child? If you look at the venous pooling under the eyes, you can see that with adults too who are sleep deprived. Again, side profiles of the face. The recessed lower jaw, and then of course this just shows you how the normal face should develop. And this is what I meant earlier about this time's running out, because as you can see from this slide, if you take a child who's now 12, 13, 14, 94% of their face is already developed, right? So what dentistry is still doing now with adults, because I've seen it done, they can of course break your jaws, move your jaws forward, it's more invasive. And there's not a guarantee with that, because going back to what I said earlier, the neurocognitive part, and I'll show you in a minute here for the sake of time, the normal face should be forward and downward. And there were some studies done, again going back to more primitive cultures and also where there is no processed food. And you can see this jaw has all the wisdom teeth in it. And there's so many teenagers now, leave their wisdom teeth out, right? Because there's no room for them. They're just crowding, the jaws are too small. It's not that the teeth are too big, it's just their jaw didn't develop to its right size. So, Dr. Coroncini did this study, and he found, of course, diet has a big part to do with this. More processed food, not eating foods that are crunchy, that have the fiber, the nutritious value that a plant-based diet promotes will definitely, so there's another reason to promote a plant-based diet, because now you can get your kids and grandchildren to grow the way they should, right? So with that said, he looked at this, and what he found was, and no matter where people were from, when they started adopting a processed food diet, the first generation had 50% malocclusion. That means teeth aren't fitting right in the mouth. Second generation, if they kept that on, 70%. By the third generation, 85% of those kids had severe, bad malocclusion, and that's pretty mind-boggling there to think of that. Again, the problem starts with infancy, pacifiers. Thumb sucking is now known as a sign of a breathing problem for kids. They're using their thumb to move, they're trying to prop their jaw forward to get better air breathing. So you can see how the teeth can end up like that. And then now you wait till they're older, the airway's not been addressed, and then you try to close that orthodontically. Guess what's going to happen? If the airway issue is not corrected, the teeth will go back out, because the tongue is a very powerful muscle. It'll move teeth out of the way to get better air. So that's like an air vent, if you will, to breathe through the mouth. These are just some of the appliances I use in the office that Dr. Bergeson created. They're used more in Europe than they are in the US, but they help the face grow. And this is one of my patients. This is a child who is a little older, And I identify her sleep deprivation, talking to her mother. And in 7 months, you can see from wearing those appliances, very, very religiously, her jaw grew to the right position. And she had her tonsils, adenoids removed. She did myofunctional therapy, had a tongue release, plus the Healthy Start system. These are her x-rays. You can see that her jaw, the lower jaw moved forward there. And then here you can see her airway got bigger. The top picture just shows her teeth, how they were kind of not fitting right. On the bottom shows how they're now more fitting together better. And then here's a slide of pre-surgery to your left, down to the right is post-surgery. You can see the airways open more. And of course, there's her teeth. And so now the teeth fit in because the jaws are the right size, right? So is the tongue too big for the mouth, or is the jaws too small? That's the question, right? So, and one of the things that Dr. Rimmer, he is the guy who discovered what's called the AutoPAP, those of you who are CPAP. That's a statement he made, and I'm shocked. He says, obstructive sleep apnea would not exist if the upper and lower jaws were ideally placed in the face. This is not a dentist saying that. So that's an expert in the field of sleep medicine making those statements. With the sake of time, I'm going to show you this last video, and you can see, and then we'll have some questions. I have a lot more to show you, but it's, like I said, I try to pack in a lot here to hopefully inform you, but hopefully enjoy this.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding. Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today. In the 1800s, orthodontists in favor of extraction were looking for more effective ways of pulling teeth back, and this is where the story of headgear starts. Not understanding the cause, those orthodontists believed in a myth that in buck-toothed children, the upper jaw was overgrown. They thought that if they restrained its growth with headgear, the lower jaw would catch up and the teeth would line up. Although studies done throughout much of the 1900s have shown otherwise, this myth became a part of the foundation of conventional orthodontics. First, studies have shown that headgear suppresses the growth of both jaws, causing them to grow down and back into the airway, creating a clockwise rotation of the lower third of the face. The industry coined these deformities the headgear effect. The growth changes caused by headgear carry on into adulthood. In order to breathe, she will slouch her head forward to prop open her airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. A simple physics diagram shows that the growth stunting forces of headgear pass right through the skull. One study showed that headgear caused an abnormal rotation of the sphenoid bone, and no study has examined the impact of headgear on the skeletal blood flow and nerve pathways of a growing child, or its long-term effects. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws and dental arches, the palate is too small for the fully grown tongue, which is sitting back to begin with. When she sleeps, her tongue does not suction, rather it falls back and cuts off her airway. This is obstructive sleep apnea. Like crooked teeth, it's a modern condition. However, it can reduce life expectancy. Not surprisingly, obstructive sleep apnea is marked by the same traits that describe the headgear effect. Both jaws are grown down and back, creating a clockwise rotation in the lower third of the face.
So I'll stop it there for the sake of time, and hopefully I communicated to you. Like I said, there's a lot more to share, but I was trying to condense this information on the importance of craniofacial growth and development and how our profession is making a change to catch kids earlier. But also, we help adults because adults also, like I said, surgically that can be done. I'm not advocating that because that's not for everybody. What I do is a non-surgical approach with oral appliance therapy to move the jaw forward. That's just one method. And of course, there's positive air pressure, which also helps. And then of course, we work with physicians like ENTs that open the airway. So there's a combination, it's a journey. And sometimes it involves a group of physicians that are like-minded and dentists. But the number one thing I would say, and even he's told me, one of the surgeons we work with, every time he's done surgery, he says, every time I do surgery on a plant-based diet, somebody who's eating a plant-based diet, there's less inflammation, less bleeding, so it's caused him to change his diet, right? So the thing is what you're doing here is important, and definitely, so I hope what I shared today, you learned something from it. If you have questions, I'll hang around, and I appreciate coming to speak with y'all this morning. Yes.
Who has questions for Dr. Gonzales? Yes, Jerry.
What causes snoring? Like what's like the, I guess, the medical deficiency there that physiologically, I guess, what's causing?
The quick answer is that the tissues can become loose a little bit, and also if there's obstructions, really it goes down to the pressure that we're sucking in to breathe the air. And so when we're asleep, we create more negative pressure. Hence, CPAP is positive air pressure to counteract the negative pressure, right? So when you create negative vacuum suctioning, the tissues that are loose or hanging longer, they kind of flap and make that sound. That's really what causes it. Yeah. Yes.
Don't you wonder, being as dental is so important, like Medicare and such, they don't even pay for dentists. I mean, it's like, it doesn't make any sense because it's such a big part of your health.
Yes, absolutely. And I didn't get to that slide, but there was another book called Teeth, Teeth, and it was written by a journalist. And the story is the first dental college in the world was in Baltimore, Maryland, right? And there was, not too long ago, fortunately, a young boy died less than a mile from there from a tooth infection and just access to care, right? And so the reason I'm bringing that story up, it was in the 1840s when dentistry started. It was going to be a subspecialty of medicine, but the discussion that night that happened, whatever the disagreement was, it got set off as its own thing, right? And so, but yes, you're right.
It's not its own thing.
No.
It's the whole.
Exactly. Yeah. Oh, yes.
Just before, may I, forgive me, Susan, can you hold it for just a minute? I have a question, but, but hang with me, that I think, okay, I'm going to preach a little bit here. I think it will help to tie what you do here and what you eat with what you are trying to prevent. So when the baby is weaned off breast milk and the baby is fed meat, dairy, eggs, oil, you know, when I say meat, I mean chicken and fish and seafood. When the baby is fed that, the nasal passages block off and obstruct, whether the baby is formally diagnosed with allergies or not. And that makes that little mouth come open, and that brings the tongue out of its normal position, so the jaw doesn't grow in a full U shape. It grows in that narrow V. No room for the tongue, pushes the tongue back. Fast forward to age 45, everything's starting to wrinkle and sag on the outside, everything's starting to wrinkle and sag on the inside. And even if you're not sleeping, boca arriba, with the face up, even if you're on this side or your other side, the tongue can block the airway, leading to high blood pressure, diabetes, more cancer, 65 times more cancers in people with untreated sleep apnea than people who don't have sleep apnea. So my question for you is, how can we get the word to young parents that what they feed their children when they are weaned off breast milk is so critically important to the health of the entire lifespan?
Yeah, so one of the efforts that and that's a good question, is really reaching out to your schools, right? To the nurses, the people that work with children, even in your churches and all that, to try to get that message out, because that is very quickly looked over. And in all the training and education I've gotten with this sleep disorders, nutrition is kind of pushed over there, right? It's really not looked at. And that's really the thing that kind of irks me, because that's really very important, as Dr. Carney alluded to. And so really it's a community grassroots effort to try to get groups, small groups, to educate and inform. And then that way they can, hopefully get the message out. Yes.
One more question before I go to Susan.
Yes.
Have you found your way to a plant-based diet, doctor?
Yes, I did a plant-based diet because of cholesterol issues. That's what drove me to it. One of the reasons, like I said, eating cleaner definitely has helped me feel better and healthier. I suffer from sleep apnea myself and been recently tested again through this new method, and it turns out I'm more severe than I thought because of the detection level. And so that's caused me to put on a little more weight than I would like to have, and I was running, and of course practicing. So to answer your question, yes, plant-based diet is important, and I adhere to it, and I definitely advocate it. But the other part of that is the sleep, right? Getting the restful sleep, that unfragmented sleep, because that all ties together. And what I would say with that, even if you're vegan, plant-based, if you're not getting good sleep and you're fragmenting, that cortisol is going to drive you to eat more carbohydrates, more junk, like sugary food. And you see a lot of packaged vegan this, vegan that, but it's not really healthy food. You see what I'm saying? So yeah.
Susan.
What is your opinion on fluoride treatments?
Yes. Fluoride, I have a background in chemistry, so I was a chemist before I became a dentist, right? And so from a chemical part of the chemical structure of teeth, I can see where it helps the tooth remineralize and protect from acidity. Again, going back to diet, most processed foods, most non-plant-based diets are very acidic, and that's really what causes tooth decay, acidity on the teeth, right? So I would say that to answer your question, I have patients who are pro-fluoride, so I still give it to them if they like it. I tell them, we have another stuff that we use, like with essential oils that are more natural, like xylitol, and that helps protect the teeth as well. But I really don't push it, because I know that if it's used too much, it's toxic to your bones and other things. So by trying to treat the teeth, you kind of affect other things, like medications, right? You get side effects from it. Yes. I don't know if I answered your question though, but yeah. Yes.
What is the proper way of breathing? Is it just through the nose all day long?
Yeah. So the proper way to breathe is through the nose, mouth closed. And you get, and the reason for that, I failed to mention, is there's something called nitric oxide. You can look that up. Nitric oxide is released when you breathe through your nose, and it sterilizes the air you breathe. It keeps your sinuses clean, and the turbinates, everything less inflamed. Because the more and more, that's why kids, when they're mouth breathing, their tonsils swell up. They're acting as a filter now. And And so they swell up, now this gets all swollen, add to insult to injury if they have a bad diet, then that gets more swollen. So now the cascade grows, their face starts to grow different, and a crowding begins, so you can see the dilemma. So yeah.
Now, Dr. Gonzales and I have a question for you all. Based on what you learned today, why is an apple a better choice than apple sauce or apple juice or even apple smoothie? Yes. So there is a factor of chewing that is so much more beneficial than the time you save by slamming back a juice, right? So yes, it's convenient applesauce, and and it hits the pleasure center because that fiber is sticky and it releases the glucose a little bit at a time as it goes down the digestive tract. But if you break the fiber, you break the stickiness, so the glucose, the simplest form of carbohydrate, blood sugar, goes into the blood and up goes the blood sugar, and that's inflammatory. It causes the release of insulin, which makes you store body fat. And it hurts your teeth and the development of the jaw. So children should be encouraged. You gotta cut the pieces small for kids, but let them chew. And of course, we're not talking about people who have had head and neck surgeries and dental issues, and they don't have the teeth. Yes, they need smoothies to be able to eat the good, healthy, plant-based stuff. But for those of us who have teeth, there you go.
Yeah, one thing I didn't show you for the sake of time, there was a slide I had that each tooth, now this is from the medical literature, each tooth you lose increases your chance for sleep apnea by 2 to 5%. And that they found is that the edentulous population, when you take all their teeth out, their tongue gets wider, and that adds them to eat more processed, softer diets. Of course, dental implants have helped with that to get teeth back. But to your point, a lot of times Medicare doesn't cover it unless it is an infection of medical necessity. But if it's a reason for dietary issues, they turn their head.
That just seems ridiculous.
Yes. Oh, yes.
Yes.
What are some of the commonly prescribed medications that interfere with sleep?
Wow. Yeah, what I've seen, so like benzodiazepine drugs that help people with anxiety issues, sometimes those medications can cause people's airways to kind of, like really narcotics, really more like, they're sedative drugs. I can't specifically give you a whole list, I can talk to you afterwards, but some of those drugs also induce clenching, grinding, but they cause the airway to collapse more. And by the way, I'm glad you asked that question because to date, I was at a conference last month in San Antonio, the annual sleep conference. There is no drug to treat these problems. In other words, the pharmaceutical companies are working on drugs to help you sleep better, but to treat obstructive sleep apnea, there's absolutely no drug. And I always say this to patients, I guarantee that if there was a drug to be sold, that everybody would know about it because the commercials, all the advertising that goes into it. But because of that reason, it's a physiological problem and they don't have an answer. So that's where it comes back to form, function, and breathing. And those are the things that, again, the profession of dentistry along with physicians can help somebody get to. Yeah. Any other questions? Yes.
What do you, just on that same subject, what do you think about the use of melatonin, which is more natural?
Yeah, so melatonin as a supplement, it depends because it depends on the sleep study. I always go to that, right? Because some people, the severity, some people are milder. But, supplementing can hurt, but it depends on all the cascade of other things going on with the health. I naturally don't promote a lot of supplementation because if you get better breathing, I really try to work with a physician because our role as the dentist is really like if somebody needs to come off something or get on, we can promote supplements, but it really goes back to the sleep study, their severity, their airway. I don't see it, to answer your question, as a bad thing, but it just depends on the dosage and how they use it, right? Yes. I'm sorry, yes.
I was wondering, since you're specialized in sleep, I do have some sleep issues, but I think they're more like anxiety related,
Yes.
not breathing. Like my husband never hears me with breathing. I don't feel like I have breathing issues.
Yes.
But it's more like if I get too excited about something, or if I have so much, I just have running thoughts or whatever.
Mm-hmm.
Is that anything that your area can help with, or?
Yeah, so I work as I triage patients to try to find and again, that's the way I'm set up, with the technology we have, the CT, I can look at the airways, there are blocked airway, but I work with sleep psychologists, I work with, so the sleep studies just to find out what's going on in your sleep, but also if there's breathing issues, that are causing you to have more anxiety. Because inappropriate breathing, I didn't get to all those slides, if you breathe too fast, that's just as bad as having a blocked airway, because it just stimulates your sympathetic nervous system. And one of the things I didn't show for the sake of time was tongue ties, which are huge. Your tongue can be tethered to the floor of your mouth, and they can't go to the roof of your mouth. And that's connected to all your fascia down to the tip of your toes. So some people can have this incredible stress on them. And then now you add the factors of life, the stress of living. So now you feel more stressed, right? And then when you're trying to relax, you just can't shut down. And so some people even turn to substance abuse for those reasons to try to check out, And so when it comes down to just breathing is really important. And of course, anything that's tethering or obstructing the airway does increase that sympathetic drive. And that's where the anxiety, and of course, fragmented sleep interrupts REM sleep. And it's shown in medical literature that if you interrupt REM sleep, you're I wouldn't say guaranteed, but you see more anxiety and depression linked to that. So, yes. Yes?
How do you know someone's tongue-tied?
Yeah, there's an examination by looking, and I usually tell people open your mouth as wide as you can. Try to touch the tip of the roof of your mouth with your tongue, like put it up there, without closing your jaw. So if you can't do that and your jaw's moving, that means you've got some tongue tie. It could be posterior or interior, yeah. And so that's what's another factor that affects all this, yes. All right. Any other questions? I didn't want to take the time too much. Oh, go ahead.
How much difference does the sleep position and size of pillow and that kind of thing?
Yeah, sleep position is important. Of course, sleeping on your back, whether you have this problem or not, on any sleep study will show you at your worst, because the gravity of the tongue going back, and of course tongue ties, obstructed airways contribute to that being worse. But positional therapy is a form of treatment with sleep apnea. Some people are told to sleep on their side, and then from the sleep study they find which side you can sleep better at. But as Dr. Carney alluded to, if the tongue's there, it can still block your airway no matter where you're at. I find treating a lot of TMJ patients with the jaws pushed back, those patients tend to sleep on their bellies more to try to get their airway open. And that kind of propensates the problem more, because as their jaw's hitting the bed and they're breathing, it kind of shoves it back, right? So, but yeah, body position is one factor that we look at with sleep studies. And of course, chronic pain issues and all that, that's another factor that can limit those therapies, yes. Oh, yes?
Where do you recommend getting a sleep study?
Where do I recommend getting a sleep study? The most accurate way I mentioned earlier, unfortunately now in the Austin community, we have a doctor who was trained with Dr. DiMino. Dr. DiMino worked in Stanford. That's where all this stuff started, right? They use something called a PES, which stands for esophageal pressure manometry, and it's a little feeding tube that goes to the nose down to your chest cavity. As they put that in, it records how much effort you're taking to breathe. So if I had to get a sleep study, and I had that done to see, and that's what showed me that I was worse than I really was when I had a study done somewhere else years ago, it is the most accurate way to detect very flow-limited breathing. So here in Austin, we do have CSMA, Comprehensive Sleep Medical Associates, that can do testing. I think they just moved to Shoal Creek Boulevard up in North Austin. But that's a good place here that I recommend, because they look at all these dental components as well as part of solutions. And yes. Any other questions?
I have a question.
Yes.
What do you think of that product where they implant a wire inside you that?
Yeah, you're talking about the stimulator.
Right.
Yeah, so the hypoglossal stimulator is something fairly new that's been out a couple years. To say it this way, it depends on the patient, but it definitely will work. But again, so do I think it's a good thing? Absolutely, for the right person, but I wouldn't advocate it to everybody, just like even what I do. I sometimes talk people out of what I do if they're not a good candidate for it based on their jaw position and all that. But what I didn't get a chance to show you is that sleep medicine, sleep dentistry is looking how to help you breathe better at night. What it doesn't do, this is why I haven't given up general dentistry, is because we can actually recreate somebody's jaw, their bite, to what we call a physiological airway bite. Because I would rather have a 24/7 breathing, better breathing than just at night. Does that make sense? Because with a sleep appliances, it helps you breathe better at night, it's moving your jaw forward. Same thing with a CPAP, blowing and keeping the airway open. But when you take that off, your desire to breathe better is still there. And so I commonly see people trying to go forward without the appliance. And so we can now, through studies and things that we're studying, take somebody's bite and put it into a more favorable position that holds there. Now, will that resolve the sleep apnea completely? In some cases, yes. In some cases, it won't. It'll get better. And so I've seen it with a couple of my patients who we rebuilt their bites. And so that's really kind of where the profession is going as well with some of those treatments. Yes. All right. I guess, is that it? Or
more?
Oh, yes.
Comment out and presentation of Dr. Gonzales.
Yes.
Dr. Carney let me to him because one of my problems at the time was high blood pressure and trying to figure out why it was high. And sleep apnea can be one of the reasons. I'd also had cancer, been treated for cancer. So combination of changing my diet, going through sleep studies, finding out I had mild sleep apnea, which I never would have thought I would have had, but I guess I did snore a little bit according to my husband. I'm off my blood pressure medicine. I've been wearing the Narval sleep appliance that he had me wear, and things are better.
Awesome. Thank you. Yes, thank you for sharing that. And I'm always glad to hear that because, I treat patients that live near my area that see me for their dental, right? And I believe you live down here. So I see patients who have their own dentist who don't do what I do. And I still, tell them you can see your own dentist, I'll treat you for this. But it's always great to hear success stories, and definitely, we try to keep in touch on a yearly basis to know how you're doing or the patient's doing. And so, so that is, any other questions, I guess? I didn't want to take your time. I think you have something, or no?
Oh, she just asked me.
Oh, okay. Yes. Yeah, one last thing up there, you asked a great question. I didn't get to go over that slide. The HPA axis, that's the hypothalamus pituitary adrenal gland. This is the secretion of stress hormones. What I was showing with that, I kind of alluded to that a little bit, is that these sleep breathing problems just activate this stuff to where you're much more on a high alert. And so that's why it's harder to rest. And then you add obstructions of the nasal cavity, a tongue that doesn't fit in your jaw, and then now you have this more obstruction, you're eating a bad diet like Dr. Carney said. All those things are factors. And then now talk about stress. Your body's under stress physiologically, and now you add the stressors of life. So that's where a lot of people just can't cope with it. They seek help other ways. But a lot of times, I'm not saying all those problems are airway, but if they don't look at this and it is one of those issues, that's what the sad thing is that sometimes this gets overlooked. And so that's really my passion in really trying to educate and inform, as she's experienced, where high blood pressure is linked to these problems. And that's because that pressure, somebody asked me about the sleep study, the reason they stick that in your chest cavity is to measure how much negative pressure you're creating your heart to operate under this chamber. And so for example, if right now as I'm standing here, I'm breathing in like a -3, -4 centimeters of water, when you're asleep, they can detect how much you're sucking in. And some people I've seen as high as 20, a minus 25, a minus 40. So you can think their heart is just like trying to get oxygen and just under stress, right? So therefore, you go to the doctor, that's going on night after night, and now you say, oh, you got high blood pressure. And then you may say, well, this drug doesn't work, let's give you another drug. And so now, so the studies show that hypertension, if you're on 2 hypertensive medications, is probably a sign you have obstructive sleep apnea that is undiagnosed. And again, a lot of times, of course, it's just overlooked. And to be fair, the medical community, there's not a lot of dentists that do what I do at this point. There will be more doing it. Like I said, this policy was an encouragement to at least get dentists to see this. So if they don't treat it, they can send it to somebody that can. All right. So that's really the other problem that we have. Yes. All right. Well, I guess for sake of time, I'm going to pass it back. I do appreciate all the questions. I'll be around.